Thank you very much, Mayor. I have better news today. Our COVID case counts are falling. I'll update you on that and update you on our vaccination effort. So first, here are the numbers. Since this time yesterday, we've identified 551 new cases of the coronavirus in Philadelphia residents confirmed by the PCR test, bringing us to a total confirmed 101,629. So passing that 100,000 milestone, unfortunately, in the past week. And in addition, we've identified 73 new probable cases by the rapid antigen test. Now, for the past week, from January 10th through the 16th, we averaged 476 cases per day. That's PCR and antigen tests combined. That's so far. We expect more. And of those people tested, 7.6% were testing positive. Both of those numbers are lower than what we saw the week before. The week before, we were at 635 cases, and 8.8% of the tests were positive. So definitely a decline here in Philadelphia, and that's in the context of declines in cases all around us. Pennsylvania and New Jersey and the United States as a whole are now seeing decreases. I believe this is a downside of the spike in cases that occurred from gatherings that happened over Christmas and over New Year's. We expected that a spike would occur. We expected we'd be seeing the downside around now, and it has happened. That's good news, but let's remember that case counts are still very high, and so we still need to be taking the precautions we've been talking about. Now, in our city hospitals, this morning there were 538 people with COVID hospitalized. That number has continued to decrease since mid-December. I do think we are past the concern that I had before that our hospitals will be overrun. So we won't be reporting that number on a weekly basis right now, unless it becomes something that's a worry again. As far as deaths, we have 0 new deaths identified since yesterday. Now up to a total of 2,720 confirmed deaths. And we peaked at about 100 deaths per week for the weeks of December 13th through the end of December. Now, there's a delay of about 3 weeks between when we see a peak in cases and when we see a peak in deaths. And there's also a delay in reporting of deaths. So we'll have to follow that numbers here. I hope we'll be seeing a decline in deaths from here. Those numbers of 100 per week are still very high, much higher than we want them to be. Not as high as we saw in the spring, but still very high. And that's because of the peak in cases we've seen with this winter wave. Now, let me talk a little bit about this new United Kingdom variant of the coronavirus. In the past week, we've identified 2 patients in Philadelphia area with the B117 variant. The first was a woman in her 50s who had symptoms in the last week in December, who lived in both Philadelphia and in Bucks County, and was exposed to someone who had traveled to the United Kingdom. The second was a man in his 20s from Philadelphia who was tested on January 5th. We don't have any information yet on whether there was any connection to the United Kingdom. So these 2 cases are a sign that, as expected, this B117 variant is here in the Philadelphia area. Now, the impact of this variant on the spread here is not known. It could be that it's more infectious, and it could make the epidemic worse here in the city. The main thing we need to take from this now is we need to be even more consistent with the wearing masks and keeping distance from others. Now let me update you on the vaccination effort. We're making a lot of progress, but we still have to manage some pretty serious problems. We have a low number of doses that we're receiving. We have a large number of people who are eager to be vaccinated, even as others are hesitant to be vaccinated. And our federal information and our federal guidance, unfortunately, keeps changing, which makes it difficult for us to plan. And here's the progress so far. We have been vaccinating in what we call phase 1A. That includes healthcare workers and people who live in nursing homes. So far, we've vaccinated 72,481 people with first doses who met that definition. In addition, 15,662 people have now received their second doses. Now, those numbers include people vaccinated in the community as well as people vaccinated in nursing homes. But in our nursing homes, the pharmacies have now visited 35 of the 46 nursing homes in the city, and they've vaccinated about 2,500 residents and about 2,100 staff. Because they're finishing up with those nursing homes, they'll soon be moved to assisted living centers and personal care homes. Now, let me talk to you about vaccine availability. This week, we were allocated 10,725 new first doses of the Pfizer vaccine and 10,000 first doses of the Moderna vaccine, plus second doses that matched the first doses we received in the past for people who are coming due for the second dose. And the vaccine we have is to be used for people who meet our priority groups in the community, as well as in long-term care facilities, assisted living facilities, and personal care homes. Now, the Federal Health and Human Services had announced they were going to be releasing a stored amount of vaccine. So we were expecting a large increase in the amount of vaccine we're going to be receiving. But then last week, they said that no storage amount existed. This changing information definitely makes it difficult for us to plan. So now we've been told that we will continue to receive about 20,000 doses per week of the two vaccines combined, plus the appropriate second doses on a weekly basis through the end of February. That's true. We will continue to have a very limited supply through the end of February. Now, we know that many people are eager to be vaccinated, and that's a very good thing. But it's simply going to take months before we have enough to vaccinate everybody right now who wants vaccine. So we do ask for people to be patient. Let me talk then about our distribution process. Last week, the hospitals told us that they were nearing the end of the work of vaccinating their patient-facing healthcare workers, the people in phase 1A. Likewise, we're seeing progress in getting the unaffiliated healthcare workers vaccinated. So this week, while we're continuing to vaccinate the unvaccinated healthcare workers, we're going to begin to move into the very large group of people that's in phase 1B. That includes frontline essential workers, includes people who live in congregate settings, includes people over the age of 75, and includes people with high-risk medical conditions. So effective today, we're asking hospitals and federally qualified health centers that have vaccine to start offering vaccine to their patients with the highest risk of the conditions that meet our definition of phase 1B. That includes these conditions. First, age over 75, then patients with cancer, patients who have chronic kidney disease, patients who've had an organ transplant, and patients with diabetes mellitus. I should note that this is not all of the high-risk medical conditions that are listed in our priority scheme. We're going to recommend expand to more later, but we're just beginning now. Even so, though, those people who meet those criteria are a very large group. There are some 93,000 people in Philadelphia who are over the age of 75 and over 130,000 people who have diabetes. So even if only some of those people want vaccine, it's going to take many weeks to get through that list. Now, the hospitals and the federally qualified health centers will invite patients, and within that group, they may start inviting people who are the highest risk among them and start with the highest risk and work their way down. It's going to take many weeks for these people on this list to get vaccinated. Eventually, they'll get to everyone, but ask again, everyone, to please be patient. Now, while the hospitals are doing that, the health department will be working with organizations employing frontline essential workers to offer vaccine. Because of limited doses, we'll start at the top of that list, frontline essential workers, and work our way down. Initially, we'll be vaccinating or offering vaccine to first responders like police and fire, corrections officers, service providers who work with vulnerable populations, and people who work in public transit. Now, it's going to take us a few weeks to get through those groups. We will not get to food service workers or teachers or child care center workers yet. We will notify them when we're ready to get to those groups. Let me talk a little bit about planning. We've been asked to clarify better where the vaccine is being made available. Now, that information is constantly changing, and I summarized it at a very high level last week at the press conference. I said the vaccine would be available at hospitals and in clinics like federally qualified health centers and the city's district health centers, occupational health clinics, pharmacies, and on-site vaccination in congregate settings, and some mass vaccination clinics. But there's more detail that we have, and so we put more detail in a vaccine distribution plan that we'll be posting on our website today. But just remind people, because the situation is changing very rapidly, the plan is going to rapidly get out of date. It's going to have to be revised frequently. Now, we know that many people are interested in getting this vaccine, and people want to know how they can be notified when their priority group is reached and when they're eligible to get the vaccine. So as we move down the priority groups, we will be using a variety of lists that we have or that other organizations have to notify people that they're eligible. For example, we'll be working with school systems that have contact information on teachers when we get to teachers. And we're working, as I said, with healthcare providers and health plans who have contact information for patients who have high-risk medical conditions. But those lists won't be perfect. They won't include everyone. And so those interested in the near future can indicate their interest in getting vaccinated on a city webpage. We'll have one page for interested individuals and another one for interested organizations that have essential workers in those organizations. Now, let me be clear, what's available on the website is not going to be a registration for an appointment. There's no scheduling involved here. It's simply an expression of interest to let us know that you're interested in getting the vaccine and leaving your contact information. And then when people are eligible, we will contact them about how to schedule an appointment. Now, because we have so few doses and so many interested people, it may be weeks or months before they're notified, but people will be notified when that group becomes eligible. Now, that's sign up is not available yet. It will be accessible through our main webpage, www.phila.gov/COVID, and it'll go live sometime later this week. That's it for vaccinations. I'm going to talk a little bit about our restrictions, our safer at home restrictions. Now, this past Saturday, January 16th, we backed off cautiously on those restrictions. And as you know, we allowed indoor dining to start at restaurants with seating at 25% of their approved capacity. And all the restaurants we encouraged to improve their ventilation to reduce the airborne spread of this virus. We encouraged them to maximize the percent outdoor air in their HVAC system, their heating, ventilation, and air conditioning system. Put in a filter in the system that has a MERV, M-E-R-V, value of 13 or greater, and that they have enough air flow through that to achieve 6 air exchanges per hour at least. That means the air turns over on average every 10 minutes. And that's what's happening in restaurants. And we just remind people that we continue to not allow indoor catered events because those are clearly much greater risk, and indoor social gatherings of any size. This is the primary way today where the virus is spreading from one household to another. Now, detailed guidance on all of the settings where we have restrictions are on our website. And as before, I have to remind people that we will reinstitute restrictions if the case rates rise and if we have reason to believe the virus is spreading at these sites. In particular, if this new variant becomes a big problem in Philadelphia and we see a big increase in cases and we're worried about the hospitals being overrun again, we may have to reinstitute those restrictions. I hope not. So what should people do now? Same as before. Just to remind people, as much as we're really excited about the availability of the vaccine unfortunately will not help us get through this winter wave. Just not enough of it arriving to do that. We need to use the tools we already have to get through the winter wave. That means no indoor gatherings, no parties, no inviting friends over, no sleepovers for the kids. And I have to say this now because this season, plan now, no indoor Super Bowl watch parties. Super Bowl watch parties where a bunch of people are together and eating are just as dangerous as Thanksgiving. If you do want to get together, do it outside. And if you can watch the Super Bowl, I think you can watch the Super Bowl outside with masks. And if you go out for errands, wear a mask everywhere. And these precautions are true for everybody, whether you've been vaccinated now or not. So that's the news today. All of our information is on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. And we are now going to move to the Q&A portion for members of the press. And as I noted earlier, we will have Armando's translation of the mayor and Dr. Farley of their opening remarks when we conclude the questioning at 2 p.m. Now, though, a reminder that please ensure your Zoom login name includes your full name and media affiliation. Anyone logged in without listing their full name and affiliation will not be called on. Today, we're joined again by Managing Director Tumar Alexander. Also with us today is Dr. Caroline Johnson, Deputy Health Commissioner, and she can help with questions regarding the distribution of vaccines. Because of limited time, only one representative from each media outlet is permitted to ask questions in the first round. I will announce when the second round begins. Reporters, as always, are asked to limit their questions to 3 or fewer. And of course, the first round of questions should be on the topic of COVID-19. If we have time, we will take questions in later rounds on other topics, including the matters unfolding in Washington. If your hand is raised now and it's not a question on COVID, please lower it and we'll let you know when we open it up to broader topics. So for now, let's start off with Mitch Blocker of NBC 10.
Good afternoon, everybody. Dr. Farley, can you talk a little bit about how the Biden administration taking over changes vaccination planning and logistics for the city of Philadelphia? I know you've been interfacing with the CDC under the Trump administration.
Well, we're very excited to see the Biden administration taking over. As I said, we've had a real problem with the changing information and changing guidance from the federal government. We understand that there's a shortage of vaccine, and I understand that it may be impossible for the federal government to make more vaccine arrive more quickly. But it's impossible for us to plan if we don't know how many doses we're going to have 2 weeks from now, or if they change direction every couple of weeks on who we should be vaccinating. So consistency and communication is our main request to the federal government. I've had conversations with some of the incoming members of the Biden administration, and that message has been heard loud and clear by them. So I'm excited to have that more consistent communication.
Thank you, sir. And speaking of communication logistics, I guess it kind of rolls downhill. The Black Doctors Consortium has been vaccinating people today and a little bit over the weekend, and they're one of those groups who receives doses from the health department. And I guess over the last 24 or 48 hours, they're one group that is not necessarily known how many doses they've been receiving. And I'm curious, why is that happening? Are hospitals receiving more notice? And do you think this will be different moving forward?
Well, I'm not sure what's been communicated to them. I think we try to be clear with them about how many doses are available to them. And we just say none of the people who are providing vaccine are happy with how many doses that we're giving them because there simply are not enough to go. So we will try to be more clear farther out how many doses are going to be available for all of our providers. You know, we have not known from the federal government how many we get, but I think I'd say there's probably been some uncertainty with all providers.
And one last question for you: the additional vaccine candidates that are up for FDA review in the coming weeks, with the system that's in place, in terms of scheduling, in terms of supplies, are we able to accommodate more vaccine?
I believe so. You know, these other vaccines, I think, have less complicated storage and handling requirements than the two vaccines we're receiving now. These two vaccines are particularly difficult and complicated to store and handle. I think the vaccines that are coming up are far simpler, and so we can use the same distribution mechanisms.
There's enough capacity, though, to get more into the system?
If we had more doses, we can absolutely make more doses available through our distribution, yes.
Thank you, sir.
All right. Thank you, Mitch. Let's go now to David Melandra of Philly Sports Network.
Two questions. First off, for the mayor, back in July, you put a ban on large public gatherings until February 28th. As of right now, are you willing to keep that ban until February 28th, or are you looking to extend it?
Whatever Dr. Farley tells us. Doctor, do you have any plans to change that?
No, right. February 28th is a long way off. And so our current restrictions are our current restrictions. We're just going to have to see what happens to the epidemic before we make a decision on when they expire.
Is February 28th a significant date or something? Or just the end of the month?
You know, we had to put some some end date on any restriction.
All right.
Okay. And my second question for Dr. Farley, there was a report last week from Major League Baseball saying that they want to have fans in the stadiums this season, and they're going to leave it up to each team, including leaving it up to each city and state health departments regarding like what would they require for fans to allow in the stadium. Can you just give us an idea of what you'll be looking for from the Philadelphia Phillies about what will it take to let them have fans in the stadium for this season?
Well, first, regardless of what the Phillies say, we're going to have to look at what's happening to the epidemic. If this new variant gets here and case rates are raging, then we're going to be very uncomfortable with any sort of large gathering. But if case rates are low, we're going to look at how much space there are between people at any kind of stadium gathering, and what they do about enforcing mask use as the most important things that they will be doing.
All right. Thank you.
All right. Thank you, David. Let's go down to Jeff Cole of Fox 29.
Hi, folks. For Dr. Farley. Dr. Farley, President-elect Biden says he wants to do 100 million doses of vaccine in 100 days. Is that realistic?
If they can deliver that many doses that are proportional amount during that time period, we absolutely can get into people's arms.
You think there's that? I know you've said in the past, and we've asked you specifically about it, you've been concerned that the major manufacturers simply can't produce much more than what they're pushing out right now. Do you have some sense that they can upgrade it in some way, or at least fit what Biden seems to want to do?
You know, we've been given no information about the actual production process and their production numbers. The only information we get is what the federal government says, here's how many we can give to you. So I'm only making assumptions that there are limitations on their production process, and I can't give you any speculation on whether it's possible for them to ramp up that production.
One more. We were asking about the Black doctors because they have been, publicly vaccinating. We've had some access to them. So here's generally what I think. They did 500 Saturday, 500 Sunday. They'll do 500 today and 500 on Friday. So about 1,000 a week. Is that what organizations like theirs, I know there aren't a lot they're doing what they're doing, is generally what their allotment is going to be going forward, what the city is providing them, about 1,000 a week or so?
I don't have the exact number. I don't know. Dr. Johnson, can you answer that?
Yes, that is correct. We are committing to them roughly 1,000 doses a week while we're still constrained by our supply. We get about 20,000 doses a week, of which 10,000 are the Moderna, and that's what the Black Doctors Consortium are using. So they're getting about 10% of the supply that comes to Philly.
Really quick, do you have any ability to help them with staffing? She says she'd like more folks to just put it in people's arms.
Dr. Johnson, you want to answer that question?
Sure. Yes, we have something known as the Medical Reserve Corps, which are our volunteer nurses and physicians and other providers who are going to staff many of these clinics and can act as surge capacity for groups like the Black Doctors Consortium. Right now, there's not really enough vaccine to call them up, but we're happy to supply volunteers to assist with their efforts.
Appreciate it. Thank you both.
Thank you, Jeff. Let's go now to Jacqueline Lee of 6ABC.
Hi, Dr. Farley. Can you explain, so Dr. Levine just said they are expanding phase 1A to include people age 65 and older, but you said in Philadelphia it's for people 75 and older. Can you explain that disconnect?
Yeah, so we have a priority system that was developed through our local vaccine advisory committee. The state has their own priority scheme, and they are different. And so I'm not going to say that the state's is wrong or ours is right. I'll just say they are different. Our priority scheme was developed in part because we recognize an awful lot of people who are at risk in Philadelphia do have these chronic medical conditions. Particularly around, we have to concern ourselves with racial equity here. And many people, African-American folks, have diabetes or heart conditions that put them at greater risk. We want to make sure that they have early access to vaccine. And somebody who is 65 and healthy maybe shouldn't be in front of them in line. So it's going to be a little bit complicated, that our system is going to be somewhat different from people in the suburbs. But we do think this is the right decision for Philadelphia.
Okay, and then also, when it comes to people signing up, we have some viewers who don't have computers, smartphones, or internet. And then do you still want people to use the COVID Ready website?
Let me be clear. I think there's been a lot of confusion around this. So I'm glad this question came up. There is a website that was set up by an organization called Philly Fighting COVID. That is not the city's website. They have set up that website. That is not the city's website. The city will have a website sometime this week when people can sign up. Now, it's only for people who have internet access or they can get there through a smartphone, but the city will have a sign up. In addition, though, we do think that most people who become eligible will get notified through these other mechanisms we have, through lists from the healthcare providers or their employers. You're muted. I can't hear you.
Yeah, Jacqueline, were you finished? Yeah, go ahead.
So the website the city's putting up, though, you said you can't really directly sign up. You can only just show interest.
Right. That is the same as the websites that these other organizations have set up. My understanding is they're not scheduling. That's just the name is there, and then they receive an invitation later.
All right, Jacqueline, are you good? Yeah. Let's move on now to Laura McChrystal of the Inquirer.
Hey, to kind of go off of the question about the state's plan to vaccinate residents over age 65, Dr. Farley, do you have any plan for when that age group in the city would be able to start getting vaccines, like in which priority group?
They're in priority group 1C, and so that's going to be further down the line here. And I should point out, though, that many people over the age of 65 have these chronic medical conditions. So the people who are vulnerable over age 65 will be eligible, if they have the conditions I just gave you soon.
Okay. And then as far as the group 1B, the way you broke it down today was kind of almost into priority groups, starting with age 75 and those medical conditions, then moving to some other essential workers. How long do you expect each of those groups to take? Like, is there any guidance you can give on when other people in 1B will start getting their shots?
So first, just to be clear, the way that we laid out our priority scheme has sort of two columns. One is the frontline essential workers, and the other is the people who are vulnerable by nature of their condition or where they live. And so we're going to be working down both of those lists sort of simultaneously in the general order in which they're listed on that summary. But to answer your question, how long will it take to get through that is very hard to predict because we don't know how many people in those groups are going to want to have the vaccine. Just because they're eligible doesn't mean that they will accept the vaccine. I can say it's going to be some number of weeks and maybe months because there's a very large group there in 1B.
Okay, and just to clarify, you said you're working simultaneously through these two columns, but then is it correct that starting this week, it's only going to be for people over age 75 and those with these health conditions such as diabetes? Or will you also be starting other frontline workers?
We'll be starting frontline workers this week, or they become eligible this week. Now, we have to work with the organizations, and they may not necessarily be ready, but some of them may get started this week, or if not, next week.
Okay, thank you.
All right, thank you, Laura. Let's go to Manny Smith of CBS 3.
Dr. Farley, with all of these different categories of folks who can get vaccinations and when they can't, and how they differ from the state, are you concerned about vaccine confusion, and what are you doing to kind of address that?
I'm concerned, excuse me, it is complicated, it's going to be difficult. We're simply trying to be as clear as possible with our information on our website, our information with our providers. And there's some that's pretty simple here. If you're over 75, that's pretty simple. If you're a healthy person under 75, you're not eligible, that's pretty simple. If you're a frontline worker, you're going to be notified by your employer. So yes, there'll be plenty of confusion. Yes, there'll be, unfortunately, many people who want to have this vaccine but can't get it for some period of time because there's not enough of it. But that's just simply where we are right now with the number of doses available in the country.
Outside of the definition,
Manny, I just wanted to add part of what we're doing also is expanding the amount of time that you all have for questions because we understand that there is confusion and we want to make sure that you folks are clear so that you can help spread the word about where things stand.
Thanks. We always appreciate you guys on that. My second question for Dr. Farley is that with the groups like Philly Fighting COVID and the Black Doctors Consortium, they have been distributing vaccine a little outside of what the definitions you gave in the presser today. Again, just to make sure that, hey, we're not making anyone who received it feel guilty or, hey, or have people understand what's allowed to be distributed. Can you explain the relationship with those groups and how they're going to determine eligibility?
We have, all of the providers who are getting vaccine, including those groups, have been told, here's what the priority schemes are, and here's the people who should be vaccinated. Now, if people come and they say something that's not true, they say, I'm a healthcare worker, and it's not, it's impossible for those groups to be aware of that, and so they'll probably vaccinate those people. So while we're doing that, we're also trying to communicate to the public about who is eligible. Up until a couple of days ago, it was only healthcare workers. Now we are expanding these groups to a limited number of other groups. So all we can really do is just try to communicate as clearly as possible. Some people will slip through who are not in those eligibility groups. We do think the majority of people who are being vaccinated are in those groups. And I think the system is such that if we try to tighten it up so much that we're certain that every single person that was vaccinated was eligible, then we would greatly slow down the process. And we also have an interest in getting the vaccine out as quickly as possible. So there will probably be some people who slip through who don't meet those eligibility groups.
My last question is for Mayor Kenny. With the change in administrations and this mix up in vaccine availability, are you planning any additional advocacy for us to get more in this case, or have any talks?
I think that's going to happen naturally due to a light years improvement in competence in this administration coming in. I mean, I think that one of the sad parts of the Trump administration, in addition to his mindset and his divisiveness, has been the total incompetence of the people of him and the people who work for him, telling us one thing, doing another, not following through, not keeping promises. I suspect that with the folks that I've seen, the lineup I've seen coming into government this week, we're going to have just a natural increase and improvement in this whole system. And I think that President-elect Biden and Vice President-elect Harris know that cities with lots of people are a priority, and we'll try to figure out a way to get us what we need, not only in vaccines and testing, but in just overall support, financial support. I'm really looking forward to 12 o'clock tomorrow.
All right, thank you, Manny. Let's go to David Muro of Philly Mag.
Yeah, hi. Question for Dr. Farley. I'm wondering, out of those weekly allocation of 20,000 doses, if you have a sense going forward for the 1B group, how many of that 20,000 will be going to hospitals who are vaccinating the 75 plus community versus the health department clinics that you alluded to, where you'll be vaccinating first responders? I mean, do you have a rough sense of sort of what you're receiving, what breakdown will be going for each side of your column structure?
Let me first just clarify that the hospitals will be vaccinating not just the 75 plus, but also people with those high-risk medical conditions. Let's see, Dr. Johnson, let's see if she can answer in a general sense for
Sure.
The distribution breakdown.
Right. So roughly half of the 20,000 is in the vaccine, the Pfizer vaccine, which requires the ultra cold storage. And we have ultra cold storage is fairly exclusively located in hospitals. So I think you could sort of make the assumption that the 10,000 doses requiring ultra cold are going into the hospital system. We split them across the network based on the size of the facility and anticipated number of patients, but that's roughly what the hospitals are getting.
Got it, thanks. And also, sort of, maybe this is for you as well, Dr. Johnson, but as it relates to distribution, it's a question of second doses. I mean, you sort of, Dr. Farley alluded to the changing prioritization, and changing kind of instructions from the federal government, but I'm trying to figure out, of the weekly 20,000 doses, is that 20,000 doses for people receiving first shots, then you're also receiving a second amount for second doses, or are the second doses being lumped into that 20K? Since I know there's not a reserve anymore that they said there used to be.
Correct. So they are not lumped in. Those 20,000 doses are for first shots. And we get our second doses actually shipped on a different day and are counted a little bit differently. So we're not including that in the 20,000.
And finally, I don't know if you have data on, since you're nearly completed with the nursing home vaccinations, but I'm interested if you have data on the percentage of eligible people so far who have accepted the vaccine, since it's obviously sort of a slightly different population than healthcare workers.
Yeah, we don't have accurate data on that because we don't have good denominators for how many people are residing in those nursing homes or how many people work in those nursing homes. Just, from what we've heard about some individual places that have reported us, it's a fairly high percentage of the residents are getting vaccinated, maybe 3/4. It's a smaller percentage of the staff that are getting vaccinated, at least on the first pass, probably less than half. But now that they will be going to these nursing homes multiple times, so I would expect that those numbers may rise with subsequent passes. For example, if they went there on a given day and an employee didn't work that shift, then that employee didn't have a chance to be vaccinated. But when they come back another time, if the employee is then working, then that employee has a chance.
Thanks.
All right, thank you, David. Let's go to Jaime Becerril of Telemundo. Jaime, can you unmute?
Yes, good afternoon. How are you doing? This question goes for anyone who can answer, please, and it needs to be translated by Armando after the question, please.
Yes.
The first one is, how can Hispanic people older than 75 years old that don't have access to the internet register for the vaccine?
Dr. Johnson, you want to answer the simplest response to that?
Hold on, I think Armando...
Let me interpret the question first.
Okay. Sure.
Yeah.
The question is, how do people in minorities, especially Hispanics older than 75 years of age without access to the internet, can register to receive the vaccination?
So I would say that the first thing would be to check with their healthcare provider that they're used to seeing. We have vaccine located in several of the clinics that are located and serving the Latinx community. So that would be my first recommendation, is to contact their healthcare provider and see if they have the vaccine available at that time. As part of our effort to get this registration portal online, we also are going to bring up a phone tree or some kind of call-in line where we will assist people in making appointments. So that's the future plans.
Bien, lo que quiero decirles primero es que revisen los que estén interesados y que califiquen, que son los ciudadanos minoritarios mayores de 75 años de edad, con su proveedor de servicio de salud o médico de cabecera primero. Nosotros hemos distribuido vacunas en las clínicas que están sirviendo a la comunidad Latinx. Esa sería mi primera recomendación. Tenemos vacunas disponibles y estamos trabajando para implementar un portal de registrarse en línea, y vamos a tener una línea de ayuda que pueda proporcionar asistencia para lograr las citas. Gracias.
Okay, and my second question, please, goes for the mayor. Does the city have a plan or strategy to help 75-year-old people with no technology to get information about the vaccine?
Let me do the interpretation of the question, Mayor, if you will. Does the city have any plan or strategy in place? Perdón, en español, disculpen. ¿Hay algún plan o estrategia que tenga la ciudad para ayudar a aquellos ciudadanos mayores de 75 años sin acceso a la tecnología para obtener información respecto a las vacunas? Go ahead.
I would ask either Dr. Farley or Dr. Johnson.
Le pedimos al Dr. Farley o a la doctora Johnson que nos respondan, por favor.
I would get back to what Dr. Johnson said. So that most people do get healthcare in the city, whether they are getting it, whether they're insured or not. Typically, uninsured people are getting healthcare at federally qualified health centers, such as the city health centers, but also including other federally qualified health centers. And then there are some other clinics that are specific to serving the Latino population. We'll be working with all those clinics to make that available. And then people can contact those clinics. Those clinics may also be reaching out to those patients through telephones.
Quiero editar lo que dijo la doctora Johnson. La mayoría de las poblaciones que obtienen su cuidado médico, ya sea que tengan seguro médico o no, lo hacen a través de centros federales o como los centros de salud de la ciudad. Y hay clínicas que prestan servicios específicamente a la comunidad latina, y ellos van a tener la vacuna disponible, y es ahí donde deben acudir para obtener información con respecto al proceso de vacunación también.
Okay, thank you.
You're welcome.
All right, thank you, Jaime. Let's go to Johan Calhoun of Chalkbeat.
Hi, Dr. Farley. Asking for clarity here, this is my first question. Educators are still listed in subgroup 1B, but they will get the vaccine at a later date. This is from what I'm understanding. Can you give a realistic time on notifying teachers, educators on when they can get the vaccine? And I ask this because I see that they are listed in subgroup 1B, but there's a number 5 next to their listing. So can you give a realistic time on when you think your office will be notifying the teachers when they can get the vaccine?
Yeah, so first, that number 5 next to their name actually points to a footnote that just defines who's in that group better. But we are going to be gradually, sequentially working down through that list of frontline essential workers. I know people want to know a date when we're going to get to them, and I would love to give them a date. Unfortunately, I can't, because we don't know how many of the people above them are going to want to be vaccinated. If everybody above them wants to be vaccinated, it means it's going to take us longer to get through there because of limited doses. If a small percentage of the people above them choose to be vaccinated, then we move down more quickly. I can say it's going to be some number of weeks, but I cannot say how many weeks it'll be.
And also, doctors can correct me if I'm wrong, a large percentage of our teachers do not live in Philadelphia, but live in the counties and in New Jersey. So if they have the availability of getting a vaccination in their own community, they should do that and reduce the number that we have to be responsible for. Is that correct?
That is correct.
Thanks.
That's a perfect segue. Thank you, Mayor Kenny, for my next question. So if you teach in Philadelphia but live in the suburbs, do you follow Philadelphia's guidelines? How does that work?
I personally don't know, but doctors.
That teachers specifically are complicated. Dr. Johnson, you want to answer that?
So the vaccine allocation in this country is based on population. So that means Philadelphia's number of doses that we get is based on the size of the population and has nothing to do with who's working in Philadelphia. We try to protect our vaccine so that it goes preferentially to Philadelphians, but we are not in a position where we can turn away essential workforce because they don't live in Philadelphia. So I think the strategy that we would like to see is that people not living in Philadelphia seek vaccine outside of the city, as the mayor had said. But in order to get our schools back operating, if we need to vaccinate people living outside the city, we will do that.
Okay, so that's, okay, just for clarity. So that's a strike against the teacher. If a teacher teaches in Philadelphia, but let's say they live in Monco or Bucks County, that's a strike against them in getting the vaccine.
Not a strike against them from us, is we will cover them if they have not gotten a vaccine from their from the county where they live. So we're not aware of what the protocols are in these surrounding counties. They have not said anything about when the teachers are going to be eligible or what procedures have been put in place to vaccinate teachers who live in other counties. What I'm saying is that if they do not get vaccinated, we will take responsibility for them.
Excellent, excellent.
Do you have one more, Johan?
Yeah, my third question is, if teachers get vaccinated, what about their family members, like their husband, wives, children, or is it just the teacher in that household?
It is only the teacher. So the eligibility for the essential workforce is based only on the person doing that position.
All right, thank you, Johan. Let's go to Martin Pratt of Philly YBN.
Give me a second. Just having problems with my device. Okay. This question is for Dr. Farley. Have you seen the news out of California with Moderna? They've stopped issuing the vaccine because of the extreme allergic reaction. Are you concerned at all about our batch of Moderna?
I have heard of one jurisdiction or one location that felt they had an inordinate number of severe allergic reactions, and so they stopped vaccinating there. Unclear what's happening there, but here in Philadelphia, our experience has been quite good. We have not had a large number of allergic reactions, and we don't think that we should stop based upon that. We do screen people when they come into the vaccination sites for any history of serious allergic reactions. We are prepared to deal with them when they occur. So not quite sure what happened out there, but we're not concerned about what's happening here right now.
Will there be, or is there contact tracing follow-up a week later with that patient that did receive the vaccine to be able to establish that there is no obvious side effects?
Well, there is a process for looking at adverse reactions to the vaccine that's been in place at the federal level that people participate in. They can opt to be followed up with by, I think it's an app on the phone, and they can provide their any problems that they had, days or weeks after. The only serious events that have occurred from this vaccine, though, have happened in a matter of minutes afterwards. So the most important step is that after people are vaccinated, they stay around for 15 minutes to make sure that there's nothing in the immediate period that's going to be bad. And if so, they're taken care of. And those problems that have occurred have been very rare.
And so just for clarity, that's on the patient to be able to say, yes, here's some feedback, City of Philadelphia or provider. I do feel nauseous and sick, and I have been that way for 7 days.
Yes.
Okay. And still the last question. You said 1C for frontline workers. Does that include not just police officers that are on duty, but also the police commissioner, department heads? Is that just going to be the beat cop and the cop that's out on the in the cars?
Ask Dr. Johnson to answer that question.
Okay.
So we have said that active duty police officers are eligible for vaccine in this first release. That's how we have defined it.
And that's all the way down up to the commissioner. Sorry.
Well, high commanders high up in the department are often on scene immediately after shooting or homicide or a major crime. They go out quickly, including the police commissioner, so they would be on the front line.
Okay, thank you.
All right, thank you, Martin. Let's go to Jenny DeHuff of Philadelphia Weekly.
Hi, how are you? Thanks. Manny Smith may have already asked my question, but I guess I'll follow it up with this. We mentioned Philly fighting COVID earlier and that they are not affiliated with the city. Have you seen any evidence or any reason to believe that organizations like this are stockpiling or even hoarding vaccines for any reason?
First, let me just say, I did not say that Philly Fighting COVID is not affiliated with the city. The vaccine that they are delivering is vaccine that the city has gotten. We have given them that vaccine to provide to patients, and we have often had staff there, but they're operating that site. But we don't have any evidence that any of those organizations are hoarding vaccine.
Okay, thank you.
All right, thank you, Jenny. Let's go to Ayanna Jones of the Philadelphia Tribune.
Yes, good afternoon. I was wondering where the city is in terms of racial data for vaccinations at this point. Do we have that available?
Yeah, it's posted on our website. I did not look at the percent by race in today. It has been running about 10% African American, which we said before is definitely too low, and that's probably caused by a combination of some places there may be barriers to being vaccinated and people just having vaccine hesitancy. So we have worked with the providers to try to make sure that they can talk to folks about their concerns, and we're talking to community leaders as well around the vaccine hesitancy problem. But that number is updated on our website. There's a graph that has the racial breakdown.
Okay, and piggybacking on that in terms of the issue around hesitancy, what is the department doing specifically? I know you mentioned something about talking to some people, but are there any efforts being driven specifically by the health department to help alleviate some of this hesitancy, to help kind of push the needle and get that percentage up higher at this point?
So first we are talking to existing providers about them. We're talking to and listening to the people who are hesitant to try to understand what the issues are and see if they can persuade people to reconsider for their own health. In addition to that, we have started conversations with community leaders. I was on a call yesterday with Delta Sigma Theta sorority and the Black clergy to talk about vaccination. We had many of those meetings. We're going to have many more conversations like that with community-based organizations and community leaders. In addition to that, we have in the works a media campaign to encourage people to get vaccinated. That media campaign will probably launch sometime in February. We don't think it's a good idea to run it right now when the vaccine is so limited, because we think it may frustrate people to say, get vaccinated if the vaccine isn't available. But we're trying sort of multiple levels to really communicate about the value of the vaccine. I completely understand why people, African Americans in particular, are hesitant, given their history in this country. But I also think it's in their best interest to be vaccinated, and we need to have just lots of conversations to deal with that.
Absolutely. And my other question, I don't know, someone may have asked this earlier, but I think it was yesterday when Dr. Ayla Stanford from the Black Doctors COVID-19 Consortium had brought up the possibility or had called for National Guard troops to help push out vaccinations. Is that something that might be considered down the line? Do you see what? Oh, go ahead.
I don't think that that's going to be necessary, and I don't think that that's necessarily the wisest way to go, even if it were. We have organizations like Dr. Stanford's group that have the capability of vaccinating. Our biggest limit right now is not vaccinating people, but rather vaccine. And if we had more vaccine, I still think we can find other groups. And the National Guard, as a military-looking group, wouldn't necessarily be welcomed in a variety of communities. So, maybe at some point we get there, but I don't think at this point it's appropriate.
Okay. All right. Thank you.
Thank you, Ayanna. Let's go to Kennedy Rose of the Philadelphia Business Journal.
Hi, Hi, thank you, Dr. Farley and Mayor Kenny, for taking the time today. My first question is for Dr. Farley. Getting off the topic of vaccines really quickly, I was just wondering, how have the first few days of indoor dining been? Do you have any concerns or highlights? And I know it's early, but have there been any discussions to increase capacity? Because some restaurateurs we've talked to have said that they are not going to reopen indoors until capacity is increased.
Yeah, I have not heard any reports from our inspectors out there. Just walking around Center City, I saw an awful lot of restaurants that were open, and that they appear to be following the guidelines, and so that was a good thing to see. I was pleased at how many there were. I'm sure that there's some that say that they can't open at that number, but it does look like the majority of them are. At this point, we're not ready to expand that capacity. While the case counts are falling, they're still, over the sweep of this epidemic, at very high levels. 400 cases a day is an awful lot of cases per day. Let's remember, back in the summer, we were down 70 cases per day. And there's still a lot of risk, and we have this variant that's maybe circulating. So and when we feel that it's safer, we will see if there's a way to very cautiously take the next step.
Okay, and I remember you mentioned briefly today and also last week that the health department was going to issue some guidance about improving ventilation inside indoor restaurants and indoor dining so they can increase capacity. I was wondering if there's any sort of timeline on when that guidance would be released.
I can't say yet. We're working on trying to move it as quickly as possible. We want to have conversations with restaurants first before we release it because it's kind of complicated. But I would only say we're trying to do it as quickly as possible.
Okay, and my last question is also for you, Dr. Farley. For the form coming out later this week or next for organizations and individuals to indicate interest in receiving vaccines when they're eligible, is this only for organizations with employees that are in phase 1A and 1B, or is this just for any organization?
Well, its purpose is really to look at organizations that would have essential workers. So that could be in 1A, 1B, or 1C. But there's an awful lot of organizations that have workers who would fall in those categories.
Okay, thanks so much.
All right, thank you, Kennedy. Let's go to Max Marin of Billy Penn.
All right, thank you, everybody. I'll keep this quick. Dr. Farley, you made it clear that Philly Fighting COVID's registry page is not involved with the city whatsoever. Does this mean that the health department does not have oversight of the medical data that was supplied by the 60,000 residents who used that pre-registry site to date?
The health department has access to data on patients who've been vaccinated, but we don't have access to the information on people who have gone to that site and registered.
Okay, thank you.
Dr. Johnson, correct me, and is that correct?
That's correct. We get information on everyone that they vaccinate, but we do not know who is signing up for the site.
Okay, thank you. And why aren't the other healthcare systems like Penn and Jefferson helping with the vaccination program for the general population the way that they are in New Jersey?
Well, the major health systems are helping with vaccination. We asked them first to go to do their healthcare workers, and they did. That was following national and local recommendations. And now that they're not complete that, but they're getting close to being complete with that, now we're asking them to go to deal with the people that they have the best access to, which are people who have these chronic medical conditions or people over the age of 75.
Okay, Max, you good?
Yeah, thank you.
Thank you, Max. Let's go. We only have a couple minutes left, so please keep your questions as tight as possible. Denise Clay, you're up.
Good afternoon, everyone. My question is for Mayor Kenny. Dr. Farley mentioned restaurants upgrading their ventilation in order to keep the virus from, really having an impact for indoor dining. Is there anything that the city is doing to kind of help restaurateurs who might want to upgrade their HVAC systems and may not have the money to do so right now, particularly because of the pandemic?
Well, we don't have any money either. So we're waiting to see what the federal government does in the Biden administration when it comes to resources for cities and states. I mean, we're still, we're still in a hold pattern as far what our future budget is going to be like, and replacement revenue that is on the table now and has been advocated for by the Secretary of the Treasury designee on Capitol Hill today or this morning bodes well, hopefully, for us getting these additional dollars that we can help more people. And we've spent tens of millions of dollars on rent relief, on all kinds of things. We have not looked at what the cost factor would be in providing resources for restaurants to rehabilitate or change their exhaust systems. We would have to wait and see how that goes.
Have you spoken to the president-elect about some of the issues that are unique to Philadelphia as he approaches the whole $1.9 trillion COVID bailout package? I have not. I've spoken to the vice president directly. I've not spoken to the president directly since Labor Day when he was in for Memorial Day when he was in for a ceremony. But the U.S. Conference of Mayors articulates the needs for cities directly to the administration, and our information is with them. Okay, thank you.
Thank you. Let's go now to Claudia Vargas of NBC 10.
Okay. Dr. Farley, I think this question is for you. When a city employee tests positive for COVID and they notify their supervisor, what does the contact tracing process entail?
So right now, as you know, when case counts went very high, we're not doing contact tracing for everybody. We're only getting about half of the people that are reported to the city. Now, if an individual, a city employee tests positive, that information goes to the safety office of that office for them to deal with trying to prevent people from spreading to other folks at the workplace. So we at the health department may not be involved in that at all.
Okay, and will the contact tracing process determine how the employee contracted the virus?
In general, no. The purpose of contact tracing, remember, is to prevent and the infection to pass on to other people, to prevent the future. It's very difficult, if not impossible, to find out how an individual employee got infected, and that's not the purpose of the process. We sometimes find some information, but again, that's not the purpose of it, and we certainly couldn't prove it.
Okay, so can anyone for certain say how an employee contracted the virus?
It's virtually impossible to know to prove how any individual person got infected.
Thank you.
Thank you, Claudia. We have two more hands raised. Let's try to squeeze those folks in. Tracy Davidson, also of NBC 10, you're up. Tracy, you're up.
Yep. Can you hear me?
Yes.
Dr. Farley, I know the health department partnered with Rite Aid to distribute to 1A, but they are not limiting it to healthcare workers who live in the city. What's being done to correct that?
We're working with Rite Aid on their procedures and asking them to follow the standards for who's in the priority group, and also trying to encourage people. Right now, they're vaccinating healthcare workers, and they don't necessarily have to live in the city. Dr. Johnson, correct me if I'm wrong, for them to be vaccinated. There's healthcare workers who would work in the city, but it's supposed to be just healthcare workers.
But they have said that that's against their company policy to limit people either registering through the website portal or in their stores.
Well, we are working with them to try to have it be only healthcare workers. If this continues, we will have them not be vaccinating healthcare workers, and we'll have it be something that's more verifiable.
You know, I think part of the problem is individual responsibility too. You know if you're jumping the line or not, and that's not good karma for you. And if you're taking a vaccine away from a 75-year-old person or a person who has existing illnesses, then you ought to examine your conscience and not do it.
Well, we're hearing from healthcare workers who aren't able to get their second dose because other people have jumped the line with Rite Aid because they're saying we cannot limit who we give it to.
Well, as Doctor said, that this is being looked at, and if they're not going to follow our guidelines, they're probably not going to be involved in the program.
I think everyone ought to be able to get their second dose. That's very important. And so if it's true that people are having difficulty in their second dose, we are going to work very hard to solve that problem.
Yeah, I have a dental hygienist who's gotten her first dose and she can't get an appointment for her second dose, and she's very worried that the time will lapse.
Tracy, we're out of time. Did you have another question?
That's it. I'm good.
Okay,
Thank you.
Very good. And let's go finally and quickly to Perla Laura of Impacto.
Okay. Ellos siempre mencionan que
para todo lo que se relaciona con la comunidad hispana, se tienen a estas organizaciones que trabajan con los latinos en Filadelfia, pero ¿cómo se aseguran que ellos estén trabajando bien? Porque creo que con 16% de la población hispana latina en Filadelfia, ellos mismos deberían de tener las herramientas para llegar a esa población que evidentemente no están siendo efectivas. Tanto para el mensaje de la vacuna, como para vacunarse, como para el distanciamiento social, etcétera. ¿Por qué usar otras dependencias?
Perla, we're very much over time, so I need you to make your question as concise as possible, please. Thank you.
This is a question that probably is best answered by the mayor. Perla tells us that there's always the city saying that there's Hispanic-based community organizations that are helping with reaching out to the Hispanic community and the Latinos in Philadelphia, which amount to about 16% of the population. However, how can you guys tell that these organizations are doing a good job at all? How is the city providing them with tools to do it? And couldn't the city itself direct its approach to the Hispanic community directly through the messages for vaccination, keeping social distancing and such? How is relying on the service organizations being monitored for effectiveness?
That would be Dr. Farley or Dr. Johnson.
Just say
Esta respuesta, la del Dr. Farley o la doctora Johnson.
All of our communications are not just in English, so they're also in Spanish, and they're directed through a variety of different channels to Hispanic community, through publications as well as community-based organizations. So it's we can't control any individual organization, but we can try to work with organizations that represent a community for them to get the messages and also get the messages out to individuals through these channels. We'll continue to do both.
Dr. Farley nos dice que nosotros trabajamos con todas las comunidades y nuestros mensajes, en este caso para la comunidad hispana, se dan en inglés y en español. Y tenemos canales de distribución que incluyen la prensa escrita, además de los esfuerzos comunitarios de las organizaciones que representan a su base. Por eso nosotros no podemos controlarlos a ellos directamente, pero trabajamos con todas las organizaciones que representan grupos étnicos y comunitarios para transmitir nuestro mensaje. Muchas gracias, Perla.